Assalamu alaikum. My name is Umar Rahmamadogwa. I'm the Commissioner for Education, Kano State.
My name is Engineer Lawan Ahmed Aminu, Commissioner of Works Housing.
Good evening, everyone. My name is Fatma Abubakar Abdullahi, Special Advisor for Special Assignment to the Government.
Assalamu alaikum. My name is Jahannam Obaja.
Assalamu alaikum. My name is Abdullahi Namama, Associate Intergovernmental Affairs.
Assalamu alaikum.
Assalamu alaikum wa rahmatullah. My name is Agibi Samutala, Senior Special Assistant to the Governor, the Office of the Chief of Staff.
Assalamu alaikum. My name is Abubakar Shahada, Senior Special Assistant to the Governor for Political Mobilization.
Assalamu alaikum. My name is Abdullah Ibrahim, SSA Digital Media.
Assalamu alaikum, everyone. My name is Hafsat Adhama, Senior Special Assistant to the Governor on Health and Education.
My name is Dr. Sadi Benjuma, Principal Private Secretary to the Governor. Thank you.
Assalamu alaikum. My name is Abdul Rahman Muhammad Sulaiman bin Kadama, SSA Entrepreneurship.
And my name is Badarabi Ibrahim here, Special Advisor to the Governor on Special Intervention Programs. Before handing over to the chair of the program, I think I will hand over to the UNICEF country representative to introduce ourselves and then the rest of us.
Thank you very much. Assalamu alaikum. My name is Christian Mugwati. I am the UNICEF representative in Nigeria.
Assalamu alaikum. My name is Rahama Muhammad. I'm the Chief UNICEF Field Office in Ghana.
Good afternoon, everybody. My name is Mike Obanda, Education Manager, UNICEF Kano. Thank you. Assalamu alaikum. My name is Opia Nixon. I work as the Chief of the Coordination for UNICEF based in Abuja and traveling the country representative. Thank you.
Good afternoon, everyone. My name is Rajan Parvok. I'm the Chief of Communications, Advocacy and Partnerships, and I'm traveling with the country representative.
Assalamu alaikum. My name is Sarak Abraham Singh, and as manager of Kano Field Office.
Good evening, everyone. My name is Rodia Kantara, Senior Executive Associate, traveling with the representative from Abuja.
Assalamu alaikum. I'm Dr. Sadat Bashir, Health Specialist at the Newborn and Chinese UNICEF Kano Field Office.
Good afternoon. I'm Muntaka Mukhtar Mohammed, Education Specialist at the Kano Field Office.
Good afternoon, everyone. My name is Tabib Saleh, the Education Officer, Kano Field Office.
Assalamu alaikum. My name is Fatima Nabu, Child Protection Specialist, Kano Field Office.
Assalamu alaikum. I'm Fatima Musa, Social Policy Specialist, UNICEF.
Good evening, everyone. I am Abigail Enyam, Nutrition Officer, Kano Field Office.
Assalamu alaikum. My name is Samuel Kalu, Communication Specialist at the Field Office.
Thank you all. And once again, you are welcome to Kano and welcome to Kano State Government House. So the next thing I think is to have the Honorable Commissioner of Health to give a welcome.
The Chief of Staff representing the Executive Governor of Kano State, Honorable Commissioners of Health, Education, Special Advisors, Senior Special Assistant, the Country Representative, UNICEF, and I encourage Ms. Christian Mugwati, the Chief of Party Kano, and
the rest of the crew, good afternoon. Your Excellency, ably represented by Chief of Staff, we are receiving the country representative of UNICEF today, the 10th of October, for her first visit to Kano since establishing of her office at the country representative. She chose to visit Kano because of the importance of Kano State in the country, especially when it comes to health. Any program that we get right in Kano, get it right on. Once we get a program right in the northern area, your program starts. This is why it goes to Kano. And let me inform His Excellency that UNICEF is into the well-being of children. Particularly, UNICEF is into the health of children, education of children, sanitation of the environment, and even water supply, to mention a few. UNICEF has been a partner in the country for decades. In Kano, they have been of immense support. All our health issues, all our health programs, UNICEF is into it, Your Excellency. So UNICEF is a very good partner, a very good support here in Kano in particular. I mentioned about 3 weeks ago that if not for the support we got from UNICEF, the current diphtheria outbreak we are having could have been something much more devastating. UNICEF has helped Kano, especially when the then government was not doing the right things, especially when it comes to counterpart funding. It was only UNICEF that was a shorter that of Your Excellency. I think UNICEF deserves an applause. Thank UNICEF for that. Let me not to preempt our principals and welcome everybody, especially our visitors to Kano. And I hope your stay in Kano will be very meaningful, and I wish you a mercy journey up to Abuja. Thank you very much.
Thank you so much, Honorable, for this warm welcome. So, having received this warm welcome from the Honorable Commissioner of Health, Kano State, we will now hear from the UNICEF country representative, Ms. Christiane. Sorry, I don't know how to pronounce it. Monduati? Yeah, so we hear about some of the pharmacies objectives of the visits, and then any other things that His Excellency.
Thank you very much, Honorable Shimpuwada Sakadi, for stay of staff of the Government House. Please share our huge appreciation and congratulations to the Governor of Kano as appreciated commissioners and directors of the different sectors, social sectors in Kano. First, I would like to say that, as it has already been expressed, UNICEF has a long partnership and history of support in Kano for the children and the child well-being of this state. There are many challenges that we have faced all through these years, and also great achievements. I can mention and congratulate the state for achieving the 100% of the COVID immunization, and this was really an example that was followed by, of course, the country also improvements that we have in routine immunization, but most recently, the response on the diphtheria outbreak. Here, we have joint efforts in this emergency with the Kano government and, of course, with the federal Ministry of Health, who has, at the same time, stepped in immediately for the response. So, as for UNICEF, I just wanted to share that during this diphtheria outbreak, we gave more than 3 million, almost 4 million vaccines, TB vaccines that are the ones for diphtheria to the country. And additional to this, we supported, as we always support, the government, the federal government, in the procurement of the necessary vaccines for the country. So in terms of Beta vaccines, for example, with the government funds, they're the ones who provide the funds and pay directly to the providers. But UNICEF is who helps on the procurement and bringing and distributing the vaccines. We have bringing to the country 18.8 million Beta vaccines and more than 11 million doses of the TB vaccine that I explained is the one that we use to prevent diphtheria. We are engaging in this case with all the campaigns. It is not just the emergency campaign, but there are planned, I think, 4 more other campaigns to reinforce the coverage of the vaccines. We hope that this action can stimulate as well, can bring some awareness in communities and families about the importance of immunizing their children. And of course, I also think it is a call for the health system to also keep and continue advancing in the routine immunization efforts. The aim is that there are no zero-dose children in the States from hereafter, because once an outbreak begins, it spreads rapidly, and diphtheria have shown this. So in terms of health, we wanted to touch on some points, and one was how we have an MOU, a PHC MOU, primary healthcare PHC, which UNICEF actively supports and provide different types of resources, but also we give our technical support. So just to say, Excellency, that we are continue working in health, that now under the new leadership that is in the state, and definitely working again in terms of primary health care, we need to accelerate on the functional primary health care centers per ward, at least 1 per ward. Hopefully we can reach the goal better before planned. And for this, it is very critical to continue deploying vaccinators, nurses, midwives, doctors, community health workers, so that this can become a reality. Having an outbreak of any type of disease paralyzes the functionality of any state. It has an impact on the economy, it has an impact on the income, and in other social sectors. So this is why we see primary health care as the key strategy. And also why this one functional PHC is because through their excellence, so we can also bring other types of services, such as nutrition. For example, we also have a concern on the moderate and acute malnutrition, and of course in terms of stunting. For acute malnutrition, it's life-saving actions. But also, both acute malnutrition and this topic has lifelong repercussions, that you cannot really do anything to reverse them. This is how malnutrition affects the intellectual capacity of children. So this marks them for life. Water and sanitation is also important, and there is a law that needs to be approved and implemented regarding the prohibition of open defecation. I think this can help. This will help a lot. It won't cost a lot of investments, but by enacting the law, this will raise the awareness of people that this is prohibited, and this can reduce the practice of open defecation. There are a number of policy plans that please come with our technical support. We want to continue funding. And of course, we have some funds in WASH that need to have a counterpart from the state so that we can advance in this regard. I really, before entering this meeting room, I was introduced to one of your female colleagues and professionals that is in charge of girls' education. And I really congratulate the authorities, the Education Commissioner, for having this vision, this very positive vision about giving a priority and a special attention to girls' education and the particular bottlenecks that they face, that keeps them away from school. So this is an excellent initiative. There are issues in regards to the more participation of women in education. So we have the Women in Education Management Positions Law. We hope it's accelerating. I understand it's 25%. But we have states where, for example, at entry level, there's only one woman for every 200 teachers, right? Teachers, leaders. So I think that here Kano can give an example of accelerating inclusion of women professionals in the education sector. Going a little bit back on nutrition, nutrition doesn't have a commission per se. It is a cross-cutting issue, so it touches on different commissions. So here I know that you have been discussing on the nutrition department, so that this has an analogy to the National Nutrition Council, which was recently launched in early September, if I'm not mistaken, or the last days of August, but I was witness there, so I know it was launched. And definitely the Kano State Child Protection Lab that we are here to continue supporting. There are specific child protection issues that we manage with the Commission of Women and Child Affairs that please know that we will continue supporting and please count on us. And I wanted to highlight birth registration. And why? Because this is a quick win for Kano and mainly for Kano children. So birth registration doesn't require millions of nairas. Basically, it doesn't require much funds. It requires mobilization and political will, Excellency, to accelerate it. We are in this message from UNICEF that if Nigeria accelerates in the next 2 years birth registry, it will not only make a difference in the country, but globally. Nigeria is the second country in the world with the highest number of children who do not have a birth certificate. So this will change global numbers. So the scale of the result, the impact is global. It's regional at Africa region level, and definitely national. And national, who plays a big role, is Kano because of the high number of children living in Kano. And that can really change the game and the situation in the country. We are here, Excellency, to continue supporting the social protection and also on the social protection through cash assistance for children who are in very impoverished conditions, which is the pilot of the child run. Thank you for letting us continue working with you all. Next year, looking ahead for next year, I think that although we revisited this year our work plans with the new authorities, and next year we'll have our first new sign program and plan with the Kano governor. So we are very much looking forward to finalize this year 2023, achieving all the results we jointly planned, and looking very much forward to continue working in 2024. So thank you very much.
Thank you so much for this detailed, explained speech. So, having heard the purpose of the visit, and then some of the other areas that UNICEF is bringing forward for partners with the state government, we will now hear from the representative of His Excellency, the Executive Governor of Kano State, Person who is the Chief of Staff. Excellent.
اللهم صل على محمد وعلى ال محمد اللهم بارك على محمد وعلى ال محمد كما صليت وباركت على ابراهيم وعلى ال ابراهيم في العالمين انك حميد مجيد. The Honorable Commissioner of Health, Dr. Abubakar Nabara, the Honorable Commissioner for Education, Alhaji Dr. Umar Haruna Kidoba, and Engineer Marwan, Commissioner for Health, Christian Woodward, the Council Representative of UNICEF, and the entourage. You are welcome to come. On behalf of His Excellency, the Executive of Kano State, he directed me to tell you that he has been eagerly waiting for this day for him to come to meet you. But you see, Governor, just around 8 p.m. yesterday, we received a call from the Kaduna State Governor that they are having a Northwest meeting in Kaduna, and from there they are having a meeting as well in Abuja. So that's why he couldn't wait to see you. But to show you that Kano is giving each and every record of your contribution to the development of children's well-being, their health. I wish to mention some of the contributions that you have made to make you comfortable that we are doing they were keeping track of all their activities. The Kano State government is aware unicef is one of the signatories of the Kano Health Memorandum of Association, along with Bill and Melinda Gates Foundation and Aliko Dangote Foundation, contributing about $300,000 into the bank state account. UNICEF supports immunization program, specifically to reach 0 dose to children. Just recently, it provided funds to support the conduct of R1 for the month of July, August, and September 2023. Provision of vaccines and cold chain management. Over the past few years, UNICEF has provided Kano with thousands of cold chain equipment such as refrigerators, vaccine carriers, cold boxes, ice packs, among others. Health systems strengthening specifically the realization of one primary healthcare center to each of the 484 wards that we have in Kano. They have provided funds in the conduct of assessment of one APEX facilities. UNICEF has supported Kano in the installation of oxygen gas plant in Muhammadu Buhari Specialist Hospital. All our doctors are grateful. Established special baby care unit in Bichi General Hospital. Support the state in the construction of multi-million state-of-the-art farmer-grade warehouse for the storage of pharmaceutical products. Emergency response activities such as the diphtheria outbreak response, COVID-19, and others which I have just mentioned. UNICEF has provided immensely in the polio eradication program and still providing resources in the sustainability of free polio status in Kano State. UNICEF has also supported social mobilization and logistics during health campaigns and programs, including maternal, newborn, and child health week. Apart from the health, UNICEF will support the state government in other areas that include facilitation of the sanitation, promotion, and elimination of open defecation, which I've just mentioned, which is a problem. Advocate for safe and equitable water supply. Reduction of out-of-school children by expanding the informal education sector. Teachers Capacity Development Program, support civil registration and vital statistics with emphasis on children, social and legal reforms that promote the well-being of the children. On our part, as we have mentioned, the need for child birth registration. In order to achieve that, the Kano State government has directed for the pre-maternal and child health. You see, all our maternity units in our hospitals, everything is free, and the mother will be given all that she requires for a safe delivery. So I think that will help the government to reduce some of that. Establishment of new pediatric hospital. You see, the reopening of Hasia Bayeri Hospital, which I'm sure the Kano representatives are aware, before the government closed that hospital, which is catering for a lot of health problems of children. And now, since inception, this government has constructed this hospital and put it back to use As at now, I received a report to be forwarded to His Excellency the Executive Governor of Kano State that in the month of September alone, 28,000 children were treated. They received consultation, drugs, and all that they need free of charge. So as at September, they treated over 28,000 children in 1 month alone. And now the hospital is being overwhelmed because they receive an average of about 2,000 patients a day. And because of that, the governor has directed the Minister of the Commissioner for Health to find another hospital that will relieve the present Hassia hospitals. Because the well-being of these children is of utmost importance to this government. Because we know they will be the leaders of tomorrow. And we have to give them all that they need so that we have a better society tomorrow. As we have mentioned in the education, girl child education, the government is giving a free education for girl child in Kano State to encourage girls to acquire Western education. The government also will provide, I think the executive governor has directed the Ministry of Transport to come out with a plan to transport this girl to and from schools free of charge. Because of the economic hardship introduced by the removal of the fuel subsidy, which has made the majority of our students unable to transport themselves to school. So because of that, the government is providing a free transportation to and from the school free. So the government is embarking on various measures so that to take care of the children, women, and the disabled. That's why it has even changed the nomenclature of the Minister of Women Affairs to be Minister of Women Affairs, Minister of Children, Women Affairs, and the disabled. Because even the disabled, this government wants them to be taken care of and make sure they educate themselves. And that's why we call them people with special needs. And the government will be there to take care of them. I will tell the executive governor about your request for a law that will reduce over-education. This is one of your requests, and I will tell him that. And I'm sure we will direct the Minister of the Environment to make sure this one is achieved, at least for the, not only for the well-being and health of the children, but of the whole citizen here in Kano. Thank you so much.
Thank you so much. Ladies and gentlemen, with the speech of His Excellency, the Executive Governor of Kano State, ably presented by the Chief of Staff, we've come to the end of this discussion. But before we close, as a tradition for us in Kano State, as a sign of hospitality, we do for all our important visitors that come in. There will be a presentation of gifts on behalf of His Excellency the Executive Governor to the country representative of UNICEF. So the media, please.
Bring you back.